I'm not going to speak because I think I have subject matter experts here who are able to talk more eloquently than I can around the issues that affect us as Black gay men. So I'm going to bring my panelists to the stage. I'm going to let them introduce themselves, but we have Mr. Carl Baloney, who is the president and CEO of AIDS United, one of the largest HIV organizations in the nation, actually. So bring up Mr. Carl Baloney. Right. We have Dr. Tyrus Ford, the founder of TNG Wellness. Yes, give it up for Tyrus. And then last but certainly not least, we have Mr. Kenneth Johnson, who's the executive director of Village Unlimited. Y'all locked and loaded? Is this thing recording? Yes, it is. It is on. It's hot. But before we get started, I just want to give you guys a second to just introduce yourselves, tell them about the work that you're doing and how you're engaged in sort of HIV prevention. Start with you, Carl, since you're next to me.
Thank you, Darwin. So yeah, as Darwin said, I'm Carl Baloney. I'm president and CEO of AIDS United. That is a role that I have sat in for about 2 months. I've been with the organization for the past decade. I was born and raised in New Orleans, Louisiana. I came up to DC to work for my then member of Congress because I've always cared about policy and our ability to have an impact on the communities that matter to us, right? I think about my journey to this work is a little sideways from a lot of my contemporaries in this work. When my boss lost his election in 2020, when a lot of Democrats lost their elections, I ended up briefly working in economic development in the Obama administration because it was an avenue that I thought I could see myself giving back to communities that matter to me, the Mississippi Delta region. And then I went to Planned Parenthood. And I'm taking a long time, but this is like, I think relevant to the scope of the conversation. I went to Planned Parenthood, Federation of America, and I worked as a lobbyist and a policy expert there for them. And I did their sex ed policy. And that's when I learned about PrEP. And I thought, I'm a gay Black man from South Louisiana, and I have never heard of this intervention. And that's fucked up, right? Like I should have been, my doctor should have told me about this. I should have known about this. And it's what got me interested in HIV policy. And so from there, the rest is history. But at AIDS United, we work, every dollar and every minute to end the domestic HIV epidemic and from a community-centered approach. So I'm really excited to be here to talk with these panelists and to talk with all of you. Thank you.
Thank you. Dr. Ford?
Yeah, I'm Dr. Ford. I am a family nurse practitioner. I have my doctorate in nursing practice. I've been practicing as an NP for about 5 years now. It's just a beautiful position to be in, and I'm so grateful to serve my community. Similar to Carl, it was the statistic in 2016 that really propelled my decision to go into primary care when the CDC released released the statistic saying that 1 in 2 gay Black men will acquire HIV in their lifetime. And I thought, damn, that's me and my brother, or that's me and my friend. Like, which one is it going to be? And that really propelled me to show up for my community. So been doing it now for a while, and I love it. I am the founder of TNJ Wellness, which stands for Trust in the Journey Wellness. I really provide low barrier services to my community. I also see people for primary care as well, tailored to Black gay men, Black queer men. And then I also work at CCI, which is a federally qualified healthcare center. So for people who are uninsured, they can definitely see me there. So I'm doing a lot of other things as well. And similar to my friend, I'm just passionate about what I do. And being an HIV specialist, this is important for me. I'm excited to talk about these topics. And yeah, let's get it.
Last but not least, Mr. Johnson.
Greetings and salutation. I am the one and only Kenneth Johnson, and I bring you greetings from Ward 7 in DC, District of Columbia. So, with that being stated, I am the CEO and founder of Village Unlimited, where we strive to educate our community where we live, work, play, and worship. And so, with that being said, it's very important for us to be community centered and community focused on those historical institutions where primarily African Americans got their formal and informal education, such as the Black church, such as the beauty and barber shops, and those historical places where we continue to rely upon for information as a pillar within our community. And so that's a lot of work that we do around community mobilization, community outreach, information and education concerning, different, interventions that will help prevent the spread of HIV within our community. So I'm Kenneth once again.
Well, thank you. And Dr. Forrest, since you kind of stole my thunder on the first question, I'm going to start with you. We've actually done a little bit better since 2016, but it's still, the stats are still disparaging. And this is for anyone, but we're going to start with Dr. Ford. When you hear the statistic that 1 in 3 Black gay men will acquire HIV in their lifetime, if current rates continue, and that only 14% of Black gay men are prescribed PrEP compared to 94% of white men, how does that make you feel?
I do want to shed light and start on a positive note. Okay, so the statistic in 2016 was 1 in 2, right? That's 50%. That's 1 out of 2 people in the room. That's 1 person contracting HIV. Now it's 1 in 3, so it's about 33%. So we are making improvements, right? I just want to acknowledge that we are making some headway. But when we think about how many white people are on PrEP compared to Black gay men who need it, the people who need it, it makes me very disappointed. Very disappointed. That's what comes up for me. I'm not sure what my other what the other panelists have, how they feel, but and it also raises the question on why. And I really don't think it's related to behavior. I think it's really a system thing. When we think about these systems, even the federally qualified healthcare center I work, there's systems that really create barriers for people to uptake PrEP. So, I think it's really what comes up for me is disappointment. So I'm curious to see what everybody else feels.
Carl?
Yeah, I think it makes me angry because I appreciate that the number has shifted a bit in the past several years, but it doesn't represent a lack of care and attention from our communities. I think it's a lack of investment in our communities, right? Like, we care about our health when presented with the data and the information in a reasonable and culturally competent way. We take care of ourselves, right? But the systems have to be built to reach us. They have to be accessible. We have to feel welcomed into those systems. So it makes me angry because this isn't hard. We want to be well. We want to enjoy sex, without fear or stigma. So there has to be change in the approach to reaching our community.
You got anything to add?
Absolutely. It makes me feel like we need to do more work as a community. And it is, what can we do, not what can they do, right? How can we utilize our platforms, our network? One of the biggest things that we have is to mobilize ourselves, right? Community mobilization is very important. And so it makes me feel that there's more work that needs to be done in these spaces and places to educate our communities, like I said, where we live, work, play, and worship. I'm not going to call the person out, but I'm going to utilize a personal conversation that we had. Like, we was having, I'm going to call it a good girlfriend conversation. And they was telling me about their sexual proclivities, right? And we was getting into the T's, like the TTs, right? And so I said, well, hey, friend, you're singing this. I think that it's important for you to be on prep, right? Because this is how you enjoy sex. This is how you like it. I'm not shaming you. I'm not stigmatizing you, but I want to educate you on some of the interventions that are out there. I'm not saying that you can enjoy the sex how you want it. I'm not saying you can have as many sexual partners as you want. But what I'm saying is, hey, this is what needs to be done. And if we take that approach within our own communities, within our own network, I think that we will see those numbers continue to decrease and more of us having access to those interventions that will help eradicate or get us to ending the HIV epidemic within our community.
Yeah, I would like to add, and say that we do have to go into different places in the community. So when we say community, people, it shows up different ways. I know for me, I'm in like 8 different sex group chats. Okay, yeah, because I feel it's important as a provider, and this is actually national. There's like a DC group chat. You'll be surprised. They're all around the nation. But the point for me to be there is to provide that expert, that expert content, to offer them DoxyPep, drop some information about that. Are y'all on PrEP? Maybe connecting them to resources. But that's requiring me to go where the people are. Yeah. The sex clubs, the parties, and just inquiring about it or just being curious. So I think that is something that we as providers need to adapt. And when we talk about going into the communities, that's what it looks like, being there like in the ground, like on the ground.
Yeah. And drop that link to the DC chat.
Will do. I think you got to be added by the administrator. Now, I ain't the administrator, y'all. I am in all the groups, though.
I think I got enough juice to get added. I'm gonna take moderator's privilege because that was a heavy question, right? And we're not a monolith as Black gay men. So I have a question for you guys. What is the last book you've read, and what impact has it had on your life? Start with you, Mr. Johnson, and don't say the Bible.
Oh, I do read the Bible. So the last book that I read was a book called Crucial Conversations: How to Have Conversations and Be Able to Listen and Not to Respond. To, conflict resolution within the conversations is very impactful, to be able to be objective in the conversation, to hear what the other person is saying and seeing a different perspective. It really opens you up to seeing, hey, well, I'm not right or wrong, but can I look at this a little bit differently? And from the landscape of where this individual experience, education, and, perspective is coming from. And so that book really helped me. So it's called Crucial Conversations. So that's the last book that I read.
Perfect. Mr. Ford?
Yeah, so the most recent book that I've read that had a really big impact on me was How to Have Confidence and Power in Dealing with People. It's by Les Giblin. And he's deceased now, but he's written other books about how to really strategize and connect with people and how to leverage that power. But it reminded me of just like having the confidence as a provider of just building that rapport, right? And creating that safe space for people to be their authentic selves. And it also allows me to show up confidently in who I am, because I do have sex. So if I'm asking you about sex, I'm going to ask you about pleasure. I'm going to make sure that it's pleasurable for you. Are you having pain? What does intimacy look like for you? Those are questions that I'm going to ask because I'm actually confident in that area. So it really just reminded me to continue doing what I'm doing. And then also it challenges me. It challenged me to start, asking these questions of my colleagues. And in fact, one of my other colleagues, she's a medical doctor, and we're coming up with workshops to really start educating our providers on how to have these sexual health conversations and be more confident in that, because they're having sex too. I hope it's good, but if it ain't, then they probably not having conversations about it. But so it just reminded me just to have the confidence and the power. And then the last point that I want to make is confidence is not arrogance, okay? And so There's a distinct difference in having confidence. That's an internal thing that you work on. Being arrogant is something external where you have to get those external validations. And this just reminds me to keep doing the internal work, keep showing up how I am, because people appreciate that. They appreciate the genuineness. They appreciate the authenticity. And so then they have the capacity to show up like that, or they mirror that. So, yeah.
Nice.
Nice.
Don't say it, Grant.
It's giving a Bible.
Yeah,
I mean, that's a good one. That's a good idea. No, I've been reading The Fire Next Time by James Baldwin. And, Baldwin, I think throughout a lot of his works, he kind of reminds you that love kind of has to coexist with integrity and accountability. I'm not as far into the book as I might like to be, but it's set up across 2 essays, right? And the first one is a letter to his 14-year-old nephew, and it centers how you want to show up in the world, and the notion that we need to create a space that is better for, that's my interpretation, that is better for like the folks coming after us. And I think that's especially poignant in this moment, right? Because Baldwin always examines the impact of like racism and bias in American society. He's unapologetic about that, but also charges us to approach it with compassion, radical compassion and love. And I think that just really speaks to me in this moment. So,
nice.
Curious to know what kind of book you read.
Yeah, what about you?
Child. Really, the last book I read was my rule book. I'm a Division I basketball referee, and we're getting ready for the season, so I just read my rule book to catch up on the rules. That's the last book I read this morning, actually. But in all seriousness, DJ Khaled, I got the keys to success, trying to figure out how to continue to be successful, thinking through strategies to optimize success in my life. So those are 2 books that I've read recently. So thinking about this, Carl, I'm going to direct this to you. Understanding it's like a tale of 2 cities. So we understand that DC is actually accelerating to their 90-90 targets, which is really by 2030, we should be at these targets really in the HIV epidemic. I think it's 90 people virally suppressed, 90 people linked to care. And don't quote me on the last 90 target, but if I was at work, I would know it. But then also thinking about like Virginia and Maryland, like they are light years away, especially PG County, from ending their epidemic because of structural system and other inequalities that they face, that DC doesn't face because of political will and those other things. So given the current landscape for HIV care and prevention in the DMV, provide an overview of what's working well and what needs to be improved to end the HIV epidemic.
I mean, I think particularly because you mentioned the gaps in our areas outside of DC and the DMV, but I think what's working well in DC is there are several amazing community-based organizations that have built trust in the communities that they serve, right? And trust is such a critical basis for folks being willing to access care because, with trust, that means you feel heard, that means you feel safe to come in and access those services, and you feel like you're not going to be judged or stigmatized for doing so. I think there are also still opportunities for those organizations. I think those organizations do amazing work with limited resources that they have, but we have to ensure that we invest in those organizations to create a pipeline, not just for success for like new leaders coming in, but for sustainability of their practices. So yeah, I would say, and I'm more proficient in what's happening in DC than in Virginia and Maryland, but those great organizations need our investment to help them kind of reach the folks that are being left out on the margins. But they're doing great work. I think of the Us Helping Us, and even I'll stop there.
Name dropping, I feel you. So Kenneth and Dr. Ford, I want to pose this question to you. We know not everyone has the same access to care, especially our Black and brown, trans and non-binary communities, and folks living in rural areas. What are some strategies to make sure these next gen HIV prevention tools aren't just talked about, but actually reach the people who need it the most?
You want to take
Doc.
Yeah. So one of the things that I really appreciate is these different interventions that we have as providers. And what I was going to add to the last question is, same day prep, in my experience, has really been has been linked to increased adherence. You start people on the same day and get them on whatever regimen that they want. And now we have long acting injectables that is really revolutionizing PrEP. And so there's options for people, especially if you don't want to take pills. That's cool. Like, we know that pill burdens is a real thing and people don't have time for that. So, I think these interventions are really changing the game. There has to be more education. And me as a provider, like I said, I'm tasked with educating my colleagues because I'm noticing my colleagues don't know enough and they don't feel comfortable asking questions, and they'll fail to do triple site screening, meaning they'll say, are you using your throat? Are you using your butt? Are you using your penis? Like, are you using the pink parts? Because you'll be surprised how many people have never ever had their throat swabbed, and then I find out they got chlamydia and all types of other stuff going on. And then I'm like the first provider that ever asked. And so, educating my colleagues, I feel like is a big task that I have right now. So that's what I'll say. I'll probably add some more after Kenneth goes.
Well, before we go to Mr. Johnson, I want to follow up because I think you did talk about sort of the prevention tools, LAI. So we now have 2-month options. We now have every 6-month options. We have a daily pill. But you brought up something around sort of STIs, and so could you talk a little bit about access to Doxy and Doxy PrEP and what that is?
Oh, absolutely. And I have one more other comment after this that I was going to bring up on the last point. But yeah, y'all, Doxy PrEP is another intervention. As I was thinking about what is working well and what needs work, Doxy PrEP kind of fell in the needs work kind of deal, just because it's new. But when I think about Doxy PrEP, if you all don't know, it is an antibiotic that's commonly used for other infections, skin infections, pneumonia. Those are some common things that we use it for. But we discovered that it actually can be used to help prevent STIs. We actually use it to treat certain STIs. And so you can use it as a way to help reduce your chances of acquiring syphilis and chlamydia. It doesn't have the best effect on gonorrhea, but it still can help. It's about 50%-ish, so it still can help. And when you think about the risk versus the benefit, I feel like in my community, there's a great need. So I'm always like the risk outweighs the benefit outweighs the risk. So I'm always going to prescribe it. And so to me, I think it's a great tool, and I keep it a low barrier for people to get it, because people should have access to it. And we know that if you have an STI, the likelihood of you acquiring HIV increases about 3-fold. So, it's really important to make sure that you're protecting yourself in that regard. Now, there are questions that come up about antibiotic resistance and all this other jazz. I'm gonna just be honest with y'all. I don't know if we're gonna be living that long to figure out if we're gonna have antibiotic resistance. I'm just being, because these things evolve over time and we don't know. So again, the benefit outweighs the risk, in my opinion. Yeah. Anybody got anything to add?
I mean, if you go to PBR or Cancun or all the other places we visit and travel to, you can go right to the pharmacia and get a 30-day supply. Don't ask me how I know.
Listen. Oh, I didn't talk about how it actually works, though. And I do want to clarify this. So when you are taking Doxy PrEP, you have to take it how it's prescribed, okay? So let's hypothetically say that you have, it's not PrEP, and this is something that is a common misconception. It's not Doxy PrEP, meaning before, prevent, it's Doxy PrEP. So this is after an encounter. So I'm going to have sex tonight. So I plan for it, whatever. I do my thing. And then 2 hours to 12 hours, preferably, you want to take 2 pills of doxycycline. Okay. And then that can help you reduce your chances of acquiring you want to take, of STIs. Now, if you have sex again, you can dose it again, but you don't want to take no more than 2 pills in 24 hours, okay? So more information, I got like pamphlets and all that other type of resources. If y'all are interested in it, I can give y'all my number that I let people text me, and it's an easy process.
We'll go to you now, Mr. Johnson. Would you like me to repeat the question?
Absolutely, please. Because I am your contestant number 3 in question and answer. And this I do thank you.
We know not everyone has the same access to care, especially our Black and brown, trans, and non-binary community and folks living in rural areas. What are some strategies to make sure these next-gen HIV prevention tools, long-acting that Dr. Ford talked about, are just not talked about, but actually reach the people who need it most?
Absolutely. As working in community, I think it's very important that we address the whole person and address the need of the person. And I'm going to use the fancy public health terminology. It's the social determinants of health, right? We've seen on the care side of it, and I'm specifically talking about Ryan White, all the parts from A through F, when we address the social determinants of health, it typically has a person engaged in retention to care, right? And so if we address those same social determinants of health, we can have a person engaged in prevention activities as well. And I think we have to do new innovative strategies that will work, that has been proven effective. And so some of those interventions is looking at things like long sustainable housing for people who are on PrEP and not in care, right? And we're talking about prevention, having access to the clinics for PrEP, for a prevention strategy, right? Because you go to some of these CBOs, federally qualified health centers, and those resources are for people who are in care, who are living with HIV. But we need to also ensure that those same resources are available for people who are not living with HIV, but are still retained in care for PrEP. And that level of access disrupts the system and brings about innovation and change, so we could continue to see those numbers decrease within the community.
I'll say representation matters too, right? I've seen a lot of peer navigation programs that have been implemented. You know, you dropped the name on one of the organizations, and I think that is very important that people see themselves for real. So the peer navigating programs, or peer navigated, peer led programs, or whatever, however you make it up, is important. So I'm sure you guys have more to add on that.
Yeah, I'm sorry. I was just gonna say, like, this is pulling the same thread, but I think the point is, too often programs are designed for community instead of with community, and folks have to see themselves in the approach, right? And so making sure that the peer navigators are of the community that we're attempting to reach, and it's culturally competent, and they see themselves, right? And so, you know, I think for uptake of any intervention, you just want to start with the people, the population that you mean to serve, and make sure that they're a part of it. And then that just goes a little further. You know, I think this work depends on developing and supporting leaders from community to propel the work forward. I don't think we've seen the successes that we've had because we brought people up along with us, and we've been able to lead it ourselves.
Yeah, and I just, I'll add, DC, when we think about what works well, Ken, if you talk about housing, DC was actually one of the first jurisdictions to pilot sort of PrEP housing for people not living with HIV. And so I want to pose this question to y'all, but I think I want to also get some audience engagement, because I don't always like to hear people just talk at me. And I think you guys all brought up a really good point. So I'm jumping around on this list a lot, as you can tell. But This is a very unique and intentional space, right? And just a shameless plug, if you're interested in hosting one of these, I do these across the country. And so we always are looking for new partners to host sort of these intimate conversation dinners. So if you're interested in hosting it, if you're interested in hosting one of these, please let me know. Or see Cam, wherever Cam is. I don't know where oh, in the back. Hey, Cam. But where was I going? Oh. What do we need to do to create spaces like this for those who we deem to be hard to reach or wouldn't engage in discussions like this? And I'll pose this to you, but also want to hear from the audience.
People are not hard to reach.
I
think, we have to create systems that bring them. Yeah, we have to create systems that bring them in and let them lead and let them tell us what they need. People are not hard to reach. So if you can't reach them, we're doing it wrong. And so we need to listen. And that's my plug again, right? For young leaders to tell us what they need, what their peers need, what their communities need.
Yeah. And I don't think people are hard to reach. This is just
that's a common term. I'm not putting that on you.
Don't fight me. I'm just a messenger.
I think that hard to reach thing is like it's stigmatizing black queerness and saying like we have this behavior about us that we don't want to seek care, we don't want to be engaged, we don't want to be healthy. And that's not the case. Like, I'm looking at all of y'all definitely care about y'all style. And I definitely think that y'all care about y'all health, I hope. But y'all all look beautiful and nice and great, and look vibrant and healthy. So I'm assuming that y'all are seeking that, y'all want that. And, saying things like hard to reach is just really negating that. And I hate it when people say hard to reach. It's a cop out. It's not, it's a system thing. It's not a behavioral thing.
So we gotta fix the system.
I want to say this. When I hear the word can't, I automatically think about the capacity not to. And so the fact of the matter is this: we have the capacity to. It's the willingness, it's the lack thereof. It is not the capacity to not be able to reach, because someone who is paraplegic can't walk. I have the able-bodiedness to walk, but if Darwin, you tell me to get up and I say no, my willingness is not there to walk, but I have the capacity to walk. And so we have to look at it a little bit differently to say, hey, where is the willingness to reach people in our community where we live, work, play, and worship?
For sure.
Yeah, go to the sex clubs. Be in 8 group taps like I am.
Now, is that
be on X? You know what I'm saying?
Is that a play or worship place? I just want to clarify.
Depending on how you look at it, it could be both.
So I do want to open it up to the audience. One, to think about how we, if anyone wants to respond to that last question that I asked, but I do want to open it up to the audience for questions after that. Nobody? Somebody got a question? No? I can't see. It's light bright. Come on.
You want the mic?
My name is Richard. I'm from DC. I grew up not too far from here. I guess the question I have, or the comment that I have, I feel like you guys were going in similar directions at the very beginning, where I feel like you talked about the number of people that have HIV and how I guess the company is not reaching out to people to educate them. But I feel like you were going in a different direction where there's personal responsibility. Like, where do we as Black men show up and take personal responsibility for our rates being high as they are? I think we keep blaming other people and, you doing this and you're doing that. Where do we show up and take accountability? And maybe we can have harder conversations, because I don't want to walk away from today feeling like, oh, this was a great conversation. It was a pat on the back. It was easy. This should be a hard conversation. We should walk out feeling uncomfortable. And I don't feel uncomfortable. So
I know that's right.
Can I ask the question? Okay, maybe I'll ask a question. How many of you all, when you go to a doctor's appointment, have questions already prepared? You've already done your research. You already are ready to challenge your provider. Oh, that's great. I love it. You think about how many people don't do that. And that just, to me, I'm always open to a intelligent debate, okay, or always open to learning, because I'm a lifelong learner as a provider, and everybody should be. But I just ask that question because that is one way that you can prepare yourself and you can advocate for yourself. I similar to you being at Planned Parenthood, having your experience when I was first learning about PrEP. My provider was like, "I'm about to send you to an infectious disease." I was like, "Girl, I don't got nothing. I'm trying to get on PrEP," and it just made me feel like, wow, like she's so uneducated and she has no willingness to learn. I even was willing to tell her about it, and she still didn't. She still was so resistant, and that could be from her background. But I wanted to ask that question. I'm so happy to see so many hands go up, because that is what it requires for you to be in a position of advocating for yourself, because many people don't. And if you are advocating for yourself, you need to tell your friends. You need to share it with your family, because they may not be asking these questions and they may not feel comfortable. And if that means putting in your phone in your notes, I'll have many patients pulling up their list, and I'll be like, damn, it's a long list. I'm like, you're gonna have to come back for some of this. but I love it, because it just really proves people are advocating for themselves and they want to be healthy. And so I just challenge you all to make sure that you are leaning into your community and letting them know how to advocate for themselves in the best way possible when it comes to their providers.
I just think that's so important, because talking to providers, a lot of times you hear that list that they have, people will bring it up at the end of the session, the last 5 minutes. And the doctor's like, "Oh, you just brought that up. We have a few minutes. I have 3 other patients behind you," right? Like, there's no shame. They work for you. Your provider works for you. Like, you don't need to be afraid to talk about whatever issue is on your mind. But I think so many of us, still, sex is still very taboo in our culture, and we don't want to talk about it. But they're not there to judge you. I know that some providers can be less open than others. I've also been, the one who, like, I'm trying to educate the provider. I'm like, why haven't you asked me why I'm not on PrEP? Or, like, you should have told me about this. You know that I'm a Black gay man, from the South. Like, why haven't you told me about this? Because I hope you're telling the other Black gay men from the South that you're seeing that they should be on PrEP if they're HIV negative, or, So I think we have to be willing, to your point, to talk about it. We have to be willing to talk about it with our peers, with our providers, in our communities.
I'm going to answer your question and say that there has to be something that I call, with my friends, self-accountability and self-awareness, right? And so you have to know how you like to have sex and how you don't like to have sex, right? And you have to say that what is pleasurable and not pleasurable to you. I was making a joke. I called myself the condom person when I first started out in this word. Child, condoms do work. Amen. But some people do not like to use condoms when they are having sex. And you have to have that internal conversation to say, hey, if I enjoy condomless sex, what does this look like for my health and my health journey, right? Is it that I am going to use PrEP? Or you know what? I don't want to use PrEP, but hey, guess what? I want to use PEP, because PrEP may be doing a Puerto Vallarta weekend. It may be doing a Black Pride in DC that I am going to get it in with several people that I can get it in with where I want to get it in at. So what does that look like to you? Or I like to get it in when I am high or when I am drunk or when I'm whatever. All of those things like that comes to self-accountability, but not only with self-accountability, if we say bruh, sis, and we love these people, we also have to hold our social network accountable as well. And that's the true community mobilization. That's the true accountability. That's the true awareness. And that's the hard conversation. Like I said, with one of my close friends, to say, hey, I know how you truly enjoy sex. Hey, this is maybe an option for you to look into. You're going to do whatever you want to do, but to have that true and real conversation. And I said that at the beginning of this panel, and that was true. It was a real, true conversation. I'm not saying don't do what you do because it feels good. Get it in, hon. But this is also an option for you to be safe because I love you and I care about who you are and your personhood.
Yeah.
I think that there is more work to be done. And I think that that's why we're having dialogues like this in the dinner to help educate and to say, hey, that these resources are available and this is where you could go get these resources available at, right? I ask my personal friends these questions. I say, if you're on an app or you are in a venue-based place, one of the things you see somebody you like, they like you back and y'all feeling it. The question is, you top, bottom, or verse. We don't ask about status and you get it in. We don't ask, have you been tested? We don't ask, are you positive? Are you undetectable? Are you on PrEP? We ask, how big is it? Let me see that hole. Let me see that pig. We don't have those conversations, and that is another part of the accountability, right? That's how we have to reconcile. That's the hard conversation.
Yeah. And listen, what I just love what you're saying, Kenneth, because it's important as a provider. I need to know what you're doing for real. Like if you getting fisted, we need to talk about that, how you can protect yourself, okay? If you want to use poppers, let me tell you, like, then we start having that conversation about harm reduction. So then I'm not bashing you about what you do. I'm not yucking your yum, but it helps me know how to best inform you so you can make an informed decision about the things that you're doing and that you may engage in, how you can best protect yourself. So yeah, it's that self-awareness that you have to have. You have to have that critical conversation with yourself, share it amongst your friends that you trust, but also posing it for your providers. Because if you hide information from me, it's only doing a disservice to you. It really, because I can help you if I know what's going on.
I mean, listen, I think you asked the right question, right? I think when we look at it, we're talking about this from sort of a clinical lens. And when I think about the work that I do every day, there are things that we still have to tackle. We have to tackle stigma within our communities, right? We have to tackle sort of where people want to access services at. There was a recent study that I looked at that said that one, there's a graying of providers, and when a provider in Black and brown communities where you have access to when they leave or close up their offices, Black men are less likely to continue on PrEP because of the distance to travel, right? And so we also think about DC is doing well, right? And so we're having this conversation in DC because that's where I work and live. But when we start to think about where we really need to have sort of the tough conversations and where we need, is one of my questions on here, is where we need people with access and privilege to advocate. We think about the Deep South. I said I'll lead our Compass initiative, which we started in 2018, which is a commitment to end HIV in the Southern U.S. And what we saw was Black and brown people who identify and look like us don't have access, right? The clinics are 45 minutes from where they live at. The providers don't want to have conversations when it comes to sexual health. And so we need to think through how we also advocate on behalf of people who are less resourced than us. I mean, if I did a survey in here, I would venture to say everyone in here probably has access to health insurance, right? But when we start to think about outside of Atlanta, when we start thinking about Macon, when we start thinking about Valdosta, when we start to think about Albany, which still has the same Warner Robins, which still has the same demographic of Black gay men, they have less access than the urban city. And so we need to start thinking about how we pull them along as well. We can have these conversations, and we're doing well in DC. But what continues to happen is we won't end the HIV epidemic until we pull these other places together and pull these other places along with us so that they have the same access, the same ability to resources that we have here. And so, yes, we can talk about it from a provider lens, but if I don't have transportation or I'm engaged in street economy to put a roof over my head, there are things that Black and brown men who are continuing to be faced with a cancer to social determinants that we're just not talking about. Like, I'll end with this. I work with GLAD a lot, and GLAD did a state of stigma survey, and what they found is that the next generation, 17 to 24, the least knowledge about HIV. So now what we're talking about is when we're on the cusp of ending the epidemic, or not even ending the epidemic, we're on the cusp of ensuring that people know. Now we have this whole new generation who we now have to re-educate. And why is that? Because we don't have sex ed in schools. When you think about sort of the Bible Belt, who is abstinence only. And so there's still some things, and I'm not going to politicize this conversation. There's some things, which is why I actually have Carl here. There's some things from a policy perspective that we have to continue to do. We can talk about, go to the doctor and have your doctor swab your hole, I'm at work, Jesus. We could go to, sorry, we can go and sing. We can tell them to go to the doctor and do a three-site test, but if they don't have access to a primary care physician, or when I lived in California, I had a primary care physician who referred me to the ID doctor, which was a referral. I had to go in 2 weeks, but before I can see the ID doctor for my PrEP, I had to talk to a health educator. How many people have an opportunity to see 3 different people before you got a prescription, right? And so we think about it from this lens of, let's just educate the provider. We actually need to turn the system on its head. The system of this continuum of care, we need to turn on its head to ensure that it works for Black and brown people. Sorry, that's my soapbox, but sorry.
So my question is, continuing on this conversation. So one, what is like a script of care? So I have a really good primary care doctor and we talk about everything, but I am also very vocal. I've been through a couple of primary care positions. And so I'm talking about what aptitude is, the technological advance, and what is an injectable PrEP. But so when you encounter these things, what is the script of care that you would recommend? And looking at the holistic, what do we do in this political environment to make sure that we're understanding this is a public health emergency? How are we advocating for all those social determinants? But and also thoughts on what injectable PrEP looks like versus the taking of the pill every day.
So what I'll say is, because this is a company sponsored dinner, if you want to have, Dr. Ford can talk to you about sort of your options around branded medication, because I'm not allowed to talk about brands and specific medications, just for a number of reasons, and I don't want to get fired tomorrow. So, but Dr. Ford can talk to you about that offline.
But in terms of a script, is that what you asked? What would be a typical script for a patient to come and be able I actually, to be honest with you, patients don't really, in my experience, don't really have much of a script. So if I had any suggestions, I would say, what's important to you? I know for me, what's important to me, I'm young, I'm fairly healthy, I ain't got no major medical conditions. Sex is important to me. So I'm very vocal about being upfront with my provider, this is an important part of my health, and really normalizing that. And then I think you can start stemming questions from that. If that's important to you, it may not be important to you. Maybe intimacy is important to you, and that may look different. So I think really doing that self-awareness, that self-analysis is going to really be helpful. And then I would challenge your provider and say, hey, how comfortable do you feel about, talking about PrEP? How comfortable do you feel about talking about sex? And that will really gauge if that provider is going to work for you or not. And don't get discouraged if you have to bounce around. I say, finding a provider is like going to a grocery store and finding your favorite grocery store that you like. You got to find the one that you like and you roll with it. But, just don't get discouraged in that, but just stay true to who you are and ask those critical questions and challenge your provider. If they feel uncomfortable, then that may not be a match. But I think the questions can be tailored. I don't know. What y'all think? It ain't no script.
I think your last piece was the most important. No, I think I think the last piece was really important around finding a provider that resonates with you, that you feel comfortable with. I think people I'm looking around, right? There's there's a pretty tight knit of generation in this room, right? And I feel like that cohort of generations in this room are more open to talking about like mental health, wellness, right? And we always hear the message of like, find a provider that works for you. It's like dating, right? The first one might not be great. Keep trying until you get somebody that works for you. I think it's important to invest in finding someone you're comfortable talking openly and honestly about your sexual health and wellness. They work for you. It's not taboo. Like, we should be able to have these conversations. And when you find that person, you can have a dialogue and you can kind of drill down on what type of sex you're having and what type of concerns and questions that you have. And I think that's one of the biggest barriers for a lot of people, because sometimes you might not feel comfortable talking about it with this 80-year-old white man who's probably straight, right? You got to find what works for you.
I think Cam said we have one additional question. I'm gonna ask you. We're gonna take one additional question, and I'm gonna ask you guys a closing question. And then I want we're gonna wrap and then make the panelists available. So if there are additional offline questions that I don't need to hear, you can ask them.
Yeah, we got the questions back here.
Hello, everyone. So, Darwin, you briefly touched on this. You were talking about the adolescents living with HIV. My question is, what is Gilead, Dr. Ty, or any of the organizations doing to address this? We know that in 2023, there were about 1.9 million adolescent girls and 1.2 million adolescent boys. This is ages 15 through 24 living with HIV. So what are any of you all's organizations doing to address the younger generations living with HIV, or to prevent them from contracting the virus? Because we know a lot of young individuals, young people, they don't want their parents to know that they're having sex, right? Because I work with youth a lot, I do encourage them to be open with their parents about, their sexual activity. I have found myself having conversations with a lot of young individuals about PrEP, but I encourage them to go to their doctors and to be open with their parents. So I want to know, what initiatives do you all have in place, or is there anything that you all are doing to address that issue?
Yeah. I do a lot. So, we worked with a number of national organizations, Advocates for Youth, worked with this organization called SEEKUS, which does a lot of policy around sexual advocacy. We partner with GLAAD to make sure that people see themselves on TV. So GLAAD just released a study that showed that in 2024, there were 0 characters living with HIV on TV, which is down in the last 10 years from 32. And so a lot of the work that I do outside of these sort of intimate dinners is I partner with a lot of influencers. And so I work for a biopharma company that is very still with our digital media, right? So if anybody got some ideas around digital media, happy to talk to you. But thinking through how we partner with, I partner with Raheem Devon. If you are, and I'll give you a really concrete example. So if you guys remember, I would want to say it was 2021. When the baby made these comments around HIV. So we worked with the baby to educate him around HIV so that he could shift his language. I like to use a lot of people first language, and so the language is very stigmatizing. And then on top of that, and I know he had some challenges recently, but we also partner with Lil Nas X to talk through when he launched his album. I think it was Old Town Road, Montero, one of them, having a senior moment up here. But we partner with influencers like Lil Nas X to really reach people where they are. And I'm not saying we do the best, we do the best at it, but it is continuing to figure out who are the right trusted messengers to get this message to the young people. And I'm always willing to be pushed to figure out how we continue to do that. If there are new partners on the ground we need to work with to figure out how we do it. But those are just some concrete examples of how we work with young people. And I think it was just recently, Carl, I know you're the policy wonk here, but it was recent that young people can now could talk to their doctors about PrEP without or Dr. Ford without having their parents involved?
It's about around age 12, I believe, is where we can start having those conversations. So I standardized HIV testing, period. Like if you come in, just know you're going to have it done, okay? And if you don't want it done, then you can opt out. But it's going to be standard of practice. And so I think that's one way where you can pick up on obviously detecting, you can screen people, you can detect, you can get them into care. And that is at age 12 all the way up. And so the other thing that we do as providers is we have to be skillful in how we have conversations around sex. So usually I'm like, hey, I'm going to ask some questions with your parent here, but I'm also going to ask you some questions alone. So like I set the tone already in the beginning so that the parent already has the expectation that you're going to get up out of this room sometime, somehow, because I want to ask them some questions because I want to hear from them. And then the other thing that we have to really realize about adolescents is that they are getting into this as they're growing and developing, they're learning their independence. And it's really important to highlight that. So like focusing the conversation to them. Don't look at the parent. Like I'm looking at the child, at the adolescent, at the teen, and asking them questions. I want to hear from you. And if I feel like the parent is like just interrupting a lot, then I will ask them to step out. And it's not out of a disrespect, but it is about allowing the child to learn that sense of advocacy for themselves because they are learning and they're growing. So we have to be skillful in how we do it. It's a delicate balance when it comes to teens. But what I found to be helpful is making sure that we set the tone in the beginning for parents to know. And then they usually are amenable to stepping out of the room. And then that's when I can ask. Now I have with women who are having sex and they want birth control, it's the same deal. Like the father may have to go into the other room and we may have to be like, oh yeah, she's coming back for a vaccine. And then we do the birth control thing, and then we have to be skillful as providers to make sure that the patient gets what they need. It's not like we're being deceptive to the parents, but the focus is on the patient, and the patient is the adolescent. That is who I'm focusing on. And I'm going to do whatever I need to do to make sure that they are safe.
One of the things I could say at Village Unlimited that we do specifically with our youth focus is two different things. Well, three. First, we work with CASAs, and I'm not sure if you all know what CASAs are, but they are the court-appointed special advocates for kids that are in foster care. So we need to advocate those parents in those systems as well. So when we talk about disrupting systems and innovation, that's some of the things that we do to talk to our CASA individuals about stigma, LGBT, PrEP, and sexual health. So that's one of the things. Also, utilizing our PTAs in the different school systems. So we're not actually partnering with the schools, but we're partnering with the PTA, which is a part of the school who help, policies within the school systems. So you can never say in a school district that we partner with the school. We partner with a PTA program. We also have different activities like this. And one of the things that we do in the training is, peer education, because I want you to think back to, and this is what I ask parents oftentimes when we're doing training. Your kids, I don't care how open door you say you had, your kids ain't telling you what they're doing for real. And I want you to think back to your first sexual experience that you had. Did you tell your mama and daddy what you was doing? Hell nah. Who did you tell? You told your best friend, whoever was in your social network. And so educating those individuals, those teens, the youth that's within that social network to give them the current skills to be able to navigate those conversations is some of the things that we do at Village Unlimited. So just to talk about what we do, focus on the youth because it's very important because they are our next generation. Thank you.
Thank you. Non-traditional partnerships is what we need to do outside of the schools. So I want to thank everyone for indulging us in this conversation. I'm going to ask you guys sort of one final question. I'm going to ask you to be succinct, please. So, we all are in this field. You know, this is what we eat, breathe, and do every day, right? And oftentimes, you know, we were talking earlier, and we consistently talk to the same folks around this. And if you could leave our guest here today with sort of one closing thought about how they use their voices, their platforms to advocate on behalf of those at the margins, because I do really truly believe if we actually reach and do enough work to actually engage those at the margins, we reach everyone else. So what is one thought that you can leave, one closing thought for people in this room to advocate for those at the margins?
Listen, I think it's listen to potentially it's what's not being said, because folks at the margins are the ones who frequently feel less safe to share their needs, to share their wants and desires, and we have to create space. I think I'm sorry, I'm taking too long already. My entire ethos right now is about the next generation of leaders and creating space for them to step up and take the lead for their own personal health and for the health of their communities.
Maybe plug in Age Watch too.
That's a great one too. Thank you. My organization, AIDS United, leads AIDS Watch. It's the only national, federally focused policy gathering for people living with HIV and allies. We have it every March. It's coming up March 16th through the 18th here in Washington, D.C. 50% of our attendees are people living with HIV, but we come and we help you take your personal narrative, your experience with HIV or HIV prevention, and shape that into policy action. So we help you shape your stories and tell your stories, and then we take you to Capitol Hill. And we have 270 meetings with members of Congress and their staff in one day to tell them why the federal programs and the funding that Congress sends to the states across the country, why they matter and the impact that they have. And that's a really great way to engage in advocating for yourselves and your communities.
I'm gonna be clear and concise. Use your voice. That's all I got to say. You know, and partner with Carl because he has the platform. But yeah, for real, just use your voice, use your platform in order to advocate. No matter how small you think it is, it's still impactful and it may change somebody's life. So don't think that, you know, just saying, just going to the Hill and just going protesting one day or just influencing policy is nothing, it's minuscule. No, it's you using your power, you advocating for yourself, you doing something great for the greater good. So I just say use your voice and don't think anything is too small, and advocate for whatever you're passionate about.
Take us home, Minister.
Oh, praise God. So I'm reminded of an African quote, seriously. When spider webs unite, they can tie up a lion. I feel like as a community within this room, and I see so many leaders at the various tables because we all are leaders. If we use our time, our effort, and our resources, we can definitely reach those within a margin to change perspectives, hearts and minds of individuals that we have the influence to change the hearts and minds of. And so that's how we change perspectives, and that's how we reach those in the margins, and that's how we end the HIV epidemic within our lifetime. Thank you.
Thank you, contestant number 3.
Absolutely.
Okay. Well, one, I just want to thank you guys for showing up on a Monday. Thank Day in the District for partnering with us, not only on this, but year round. It's always wonderful to have partners like Day in the District who consistently show up and show out for community. So yes. I have housekeeping. You don't have to leave. We are here till 10. Kim, correct me if I'm wrong. You can get a closing drink or two to go. State Network Mingle. They're going to be made. They're here till 10. And so if there are specific questions that you have for any of them or myself, please let us know. But really, thank you guys so much for your time and attention.
Thank you.
Thank you.